Can autism be prevented? This is a question that many parents and soon-to-be parents often ask. Autism spectrum disorder, or ASD, is a complex developmental condition that affects communication, behavior, and social interactions. While the exact causes of autism are still not fully understood, research has provided some insights into factors that may influence its development. Today, we'll delve into some science-backed tips that could potentially reduce the risk of autism. Let's explore what science says. Start with prenatal care. Prenatal care is crucial for the health of both the mother and the baby. Regular checkups with your healthcare provider can help monitor the baby's development and catch any potential issues early on. Taking folic acid before and during early pregnancy supports brain development and may reduce autism risk. Folic acid is a type of B vitamin that is essential for the proper development of the neural tube, which later becomes the brain and spinal cord. Studies have shown that women who take folic acid supplements before conception and during the first trimester of pregnancy have a lower risk of having a child with autism. Avoid harmful substances like alcohol, tobacco, and recreational drugs during pregnancy to protect your baby's neurodevelopment. These substances can interfere with the normal development of the baby's brain and increase the risk of developmental disorders, including autism. It's important to create a healthy environment for your baby by avoiding these harmful substances. Manage maternal health conditions like diabetes, obesity, and infections to create a healthier environment for your baby. Conditions like gestational diabetes and obesity can increase the risk of complications during pregnancy and affect the baby's development. Regular monitoring and management of these conditions can help reduce the risk of autism and other developmental disorders. Minimize exposure to environmental toxins like air pollution, pesticides, and heavy metals. These toxins can have harmful effects on the developing brain and increase the risk of autism. Pregnant women should take precautions to avoid exposure to these toxins, such as wearing masks in areas with high air pollution, avoiding the use of pesticides, and staying away from areas with heavy metal contamination. After birth, breastfeeding and proper nutrition, including omega-3s and vitamin D, can support your child's neurodevelopment. Breastfeeding provides essential nutrients and antibodies that support the baby's immune system and brain development. Omega-3 fatty acids and vitamin D are also important for brain health and can be obtained through a balanced diet or supplements. And don't forget, early intervention is key. Early intervention services can help children with developmental delays or disabilities reach their full potential. These services may include speech therapy, occupational therapy, and behavioral therapy. The earlier these interventions are started, the better the outcomes for the child. If you notice delays, consult a specialist immediately. Early signs of autism can include delayed speech, lack of eye contact, and repetitive behaviors. If you notice any of these signs in your child, it's important to seek the advice of a child development specialist as soon as possible. Early diagnosis and intervention can make a significant difference in the child's development. While autism isn't fully preventable, these steps can support healthy development. It's important to remember that autism is a complex condition with many contributing factors, and not all cases can be prevented. However, by following these science-backed tips, you can create a healthier environment for your child and support their overall development. Let's build a brighter future for every child. Every child deserves the best start in life, and by taking these steps, you can help ensure that your child has the best possible chance for healthy development.